Hey, it is 7 p.m. Central Standard Time, the only time zone that matters. You're here at Grumpy Acres. We've got a great show tonight. We've got a fantastic guest. Give us a 5x5 in the comments if you can hear me okay. Max Path, nice to see you. If anybody else is out there, make sure you're in the live chat and not the top chat so you can see everything. And I'm going to introduce our guest. Our guest tonight is well known in the prepper community. And he is a font of knowledge when it comes to medical stuff. I want y'all to say hi to Chuck Peoples of Homestead Medical. How you doing, Chuck?
Good. How are you? How is everybody?
Pretty good. Looks like we got at least one person watching us. That's good.
I see Max in there. Good guy.
So I contacted you, and I wanted to do a live question and answer thing with you. And I figured I'd ask you some questions, and then towards the end, we'll have the viewers or the people watching it post some questions in the comments, and
sure,
maybe you can answer them if they've got any.
Yeah.
Okay. So let's go ahead and get into it. Well, no. Before we do that, why don't you give everybody your bona fides so that they know you're not just some guy that walked in off the street.
Well, I'm Chuck Peoples. I've been a paramedic in EMS for 29 years. I'm a critical care paramedic. I have worked traditional EMS for a county municipal service. I've done flight work. I've done contracting work. I've worked disaster response, Hurricane Katrina, Maria, I can't remember. I'd have to sit down and try to remember all the hurricanes and stuff I've been to. I've worked overseas, and I just saw a hole when I first started going to the first couple self-reliance festivals. I kind of saw a hole of medical knowledge to the common person that's not being done. Everybody's doing the trauma stuff, and prolonged care is not being discussed. They're not discussing, okay, you've stopped the bleed, now what? You know, what if you have to take care of a patient 2 hours, 2 days, 2 weeks, 2 months? What do you do? How do you do it? And all the other stuff. It's not just trauma medicine. It's emergent.
So, I think Chuck locked up on us. Or was it me? Oh, somebody give me a 5x5 if I'm still alive. If not, hey, Hillbilly Homesteader. I think we lost Chuck. So somebody give me a 5x5 if you can hear me. Are you there? It's Chuck. Okay. Yoda says it's on Chuck. Hey Chuck, I'm going to remove you and then add you back in, and see if we can't get you going again. Okay. Chuck is at a remote location, so you're gonna have to bear with us. He's got some technical difficulties. Oh, looks like he's coming back. So let's see here. We got Max Path, we got Hillbilly Homesteader 1776, we got Amanda, and we got T-Ot, and there's Chuck. Chuck's back.
Yep. I don't know if it's my internet. It must be my internet. I'm having.
Yeah, I think it's your internet because everybody said you froze.
All right. Well, so I don't know where I froze at, but
you were telling us you got through the hurricanes and how there was a
I've worked a lot of disaster response, and I just I saw a hole after going to the first couple self-reliances of there's not anything that's being done for prolonged care, or what happens after you stop the bleed, and I wanted to bring my knowledge and that. To teach the common person, this isn't rocket science. A lot of this is skill and knowledge, and I feel like I can teach that skill and knowledge to the general public so that you can be more prepared medically and be able to take care of yourself, your family, your group when these things happen, whether it is major trauma, it's a medical emergency, boo-boos, whatever. You need to be able to do that and be prepared for it.
Okay. Well, I guess after you explaining that, the first question I've got is, at least I know around here, we've got the trauma stuff. We've got the initial stop the bleed stuff. And we're not very deep past that. In your opinion, once you get past that initial triaging and taking care of the person, what's the average homesteader missing in their kit that they should probably focus on getting that hole filled?
What do you use the most? A Band-Aid.
Mm-hmm.
I promise you don't have enough Band-Aids. You don't have enough gauze. It's going to be the minor things that you don't have. Some of the other stuff that I think people don't think about preparing for is training, and we'll talk about that. I know we'll talk about that in a little bit, but that's your most important prep, is get the training first. Dental emergencies, a toothache or a filling coming out can knock a person down. Do you have the supplies and the training for dental emergencies? Ear, nose, and throat problems, eye problems, things like that. Do you have those supplies to take care of it? Those are the things that are much more common. And to be honest, what's going to kill you is, it's not going to be probably a gunshot or some traumatic injury. It's going to be that small laceration you get while you're fixing a fence or you're dealing with animals and you don't properly clean it or properly take care of it. It gets infected. That infection grows. It gets in your bloodstream, becomes systemic. You get septic and you die from a small little cut. So a lot of those preparations for that wound care is a big thing. And also, can you clean things? Do you have the supplies to clean those wounds? And another big thing is just plain sanitation. Are you prepared to keep your body clean? Because in a grid down situation or disaster situation where you don't have conventional type utilities and stuff like that, the first thing to go is sanitation and clean water. Are you able to make clean water? Do you know how to make clean water? And do you have the plain sanitation stuff? So those are really important things. It's the little things. Plus, how much over-the-counter medication do you have? You're still going to have colds. You're still going to have allergy problems. Do you have those things?
Yep. The medicine is one that, I'm on several heart medications because I got a couple of stents in my chest, and once that happened to me, that really came into focus. Understanding how much we needed.
Yeah, little things like with cardiac problems, do you have simple aspirin? Baby aspirin. And I know people go, well, why baby aspirin? You ever tried to swallow without water an adult aspirin? Baby aspirin is, number one, it's chewable, so it's easy to ingest, and it's flavored. And, most people are, they just don't like chewing a dry pill or anything. But little things like that, it's aspirin, those over-the-counter medications that you don't think about, but you're going to need, because there's so many uses alone for just Benadryl alone. All these things can get you, heartburn, acid reflux. But in your case, where you've got prescription medicines, as I do also, have you talked to your doctor and your insurance company, get 90-day supplies, get a backup supply, see if we'll do that. There's other ways to do that to where you could start building up. And I'm not saying skip taking your medication. I would never say that, but build up your supply. The big one is diabetics, insulin. Mm-hmm. Building that up and having a stockpile, because that's one of the true medications that does kind of degrade. You have to keep refrigerated in a cool place over time. Nitroglycerin, I don't know if you're prescribed that with any of your cardiac problems, but that also is a medication that degrades, with time, that you have to worry about expiration dates. A lot of your other medications, your antibiotics, and a lot of your common pharmaceutical medications that you're prescribed, they'll last, as long as you keep them in a cool, dry place, out of sunlight, they're going to last years past their expiration date. Right.
And you mentioned the small cut that's going to kill you. Two things. First, that always reminds me, remember, did you ever see that History Channel thing they did about the people that were escaping Los Angeles and ended up out in the country, and they survived, marauders and and the sickness and all this other stuff. And at the very end, the head of the family dies because he cut himself and he got septic.
Yeah.
You know,
Yeah.
that, and then we had our neighbor does fencing, and they do barbed wire fencing, and one of his guys got a scratch off a piece of rusty barbed wire, and within 48 hours he was on life support in the hospital, and he had intravenous antibiotics going into the system for almost a week before they let him out.
I'm real big on wound care for one reason. 3 years ago, I spent over 5 months in the hospital, 3.5 months in ICU. I should be dead from basically an infection. I had absorbed a bacteria by washing my hands at a site, and it had water in a tank. It wasn't hooked up to city water. And washing the hands in the bathroom, small cut on my hand. I had that 1 in a million shot, and I had necrotizing fasciitis. For those of you who don't know what that is, you've heard of it. It's the flesh-eating disease. 87% mortality rate. I stopped breathing 3 separate times. It manifested in my leg. I had an large open wound in my leg because they couldn't close it for 6 months. And every day the dressing was changed, wet to dry dressings, debridement was done several times a week. And that's a real good possibility of something that could happen to you when you can't get to conventional medical care. If we have some sort of a systemic failure in our medical system, and if you look at it, it's already happening now. Are you prepared for these things to do that? That's why I started Homestead Medical, and that's why I came up with the curriculum of the classes that I'm doing. And to my knowledge, nobody else is doing and teaching this type of curriculum. There's nothing that says I can't teach it to you. I just can't certify you to go out and suture somebody or close a wound or start an IV or anything, to where you can open up your own, Billy Bob's suture clinic. But what you do in your own home, that's none of my business. You're a free person. Do what you like.
We're still free, nominally.
Yeah.
Okay. You mentioned some stuff that people are missing, and you mentioned training is probably being the most paramount thing that people should get. There's all kinds of classes out there for the trauma stuff. Beyond that, what type of classes should people be looking for? And I just got to tell everybody, I am a huge advocate of paying people to impart their knowledge on me. If there's somebody that's an expert in a field, when I've got the expendable income, I have no problem spending it to have them teach me to do what they do. So what classes should people be looking for?
Well, everybody can take the Cool Guy Ninja stuff. And that's what I call all the tactical training stuff. I teach it. I think it's important. You should have it. All the stop the bleed stuff, the emergency trauma stuff, absolute paramount. If you're a prepared person, you probably carry something with you daily to protect yourself. So if you're going to do that, there's a good chance that what comes out the end of that barrel can come back towards you also from somebody else. So you should be prepared to protect yourself and other people. Second, CPR, first aid is a good start. You should know those things. But really, my classes, the Homestead Medical, is it's going to show you these things. Prolonged care. What do you do after you stop the bleed? What if you don't? You can't get to conventional medical care.
Right.
So that type of training, and I don't know of anybody that's really doing any type of training like I am that is offered to the public. Is there training like this for prolonged care? Yes, but it's for medical professionals. Some of the stuff that I'm teaching is on a paramedic level, a nursing level, a physician level even. It's not rocket science. It's not. It's skill and knowledge. And I've developed a curriculum and I think a way that I can pass this on to you so you can be confident in your preparation and confident in your medical preparation.
Excellent. Speaking of your class, there was some talk. Max Pass said that your Homestead Medical class is not like nothing else he's seen offered. Can't wait to take it. And you are giving that class where in the next couple of months?
I'm going to be at the Kentucky Sustainable Living Festival. I'll be doing a one-day class that will kind of. Normally, my class is 2 days. The Homestead Medical is normally 2 days, but I'm going to be condensing it down to kind of a one-day class that gives you sort of a snapshot of everything, and we'll be doing heavily on wound care, some patient assessment, wound evaluation, and different closure techniques for wound care. And then we're going to touch on dental emergency, ear, eyes, nose, and throat, eye emergencies, fractures, dislocations, things like that. And then I'm also doing on Sunday a separate emergency trauma class, basically stop the bleed half-day class where tourniquets, chest seals, wound packing, pressure dressings, that type of thing. SRF at Self-Reliance Festival on that Sunday, the 15th, that morning, I'm doing a half-day advanced wound care where we're going to get into, all right, you've stopped the bleed. You've got to take care of a wound for 2 weeks, a month, 2 months, whatever. Wound evaluation, cleaning, wet to dry dressings, debridement, and all the different types of wound closures.
Okay. Now, and I know you went up to Jason's place for Kentucky Sustainable Living, and you gave a class there. Can people get you to come to their location and give these classes?
Absolutely, that's what I do. I will come to you. I need at least 6 people. Now, I'm not going to California. Sorry, Porterhouse, if you're on here. But I'll go. I mean, I'm going to be doing classes in the future in Florida. Max is going to bring me up to Pennsylvania with their group. Charlotte, and I'm talking with some guys in Texas right now that want me to come down. We're trying to work out some dates. So, I'll come to you. Contact me, Chuck at homesteadmedical.us. And I'll be more than happy to come. We can talk and discuss. And the unique thing about me is I've got canned classes to do, but I'll custom design the class to your group. You may have some people or a group of people who have maybe some more advanced medical care and have got that experience, and you want to focus on certain things. I'll do that and custom tailor a class to your needs and to your group.
Excellent. So I guess the follow-up question is if they can't get with you, if it's not compatible for everybody to get together, are there other people in this space that are doing something like that you would say, okay, I feel comfortable recommending this person?
The trauma stuff, Refuge Medical does a great job. Tactical Response does a great job. A good resource for any type of training like that, whether it be medical, firearms, anything like that, is bulletin.net. That's a great little site that does. Mike runs that site for free. There's a bunch of different instructors who post their classes and stuff on there. That's a good. Also, the guys at Prepared Patriot in North Carolina, those guys do some good medical classes. But Tactical Response, Refuge Medical, and Prepared Patriot are off the top of my head real quick are great places to go. And they do a lot of the trauma stuff. Prepared Patriot does a class that goes a little bit more with some prolonged care stuff. So those are people that I would highly recommend. And I've taken, or I'm going to be taking, some of their classes in the future. I still take classes. I train all the time because every time I take something, it may be something I've taken 15 times, but you learn something new from an instructor. And it may be just that little nugget of information that can make a difference or save a life for you in the future.
Okay. All right. So we've covered getting the skills, and we talked about some stuff that's lacking out of people's Homestead Medical kits. One thing I got to say, man, it's expensive. Putting together good trauma kit's expensive.
It is. I mean, believe me, I've got thousands upon thousands upon thousands of dollars of personal equipment. And I work and I know how much it is, but also in my preps. It's an all-encompassing thing. And that's one of the things I go over in my class is, what equipment do you need? There we go. I'm back. It's what equipment do you need? What do you need? What don't you need? You know, and there's certain things, and a lot of people don't realize they get the trauma stuff. That's pretty easy to get, but there's a lot more you need. And believe me, you don't have enough gauze. If you've got a one wound that you're going to have to take care of for a month, you don't have enough gauze. I mean, I'm talking, you need cases of gauze. And you don't need to store saline or sterile water. I'll give a little nugget of information, but I say this in my class. I put it out on videos. Treated tap water is just as safe as using saline to clean a wound. So if you have treated tap water, and don't take my word from it, look it up yourself. You know, get on the whole Google machine and look it up. But there, Baltimore Shock Trauma, there's several different places who have done extensive studies on this, and they show no difference as far as hurting the tissue or anything, the difference between sterile water or saline and treated tap water. It's the same thing. Now, there's certain parameters you've got to do with water, and there's certain parameters you've got to do even when you're cleaning a wound, which I teach, but you know, there's a lot of variables with that. A lot of people think you just get in there and suck it. I mean, one wound, you could flush up to 9 liters of water to properly clean it out. And that's just the first step, gross disinfection. You know, that's just the first gross cleaning. That doesn't get into the debridement and all that and how to evaluate the flesh in the wound. And those are some of the things I go over in class. I mean, wound care alone is a huge monster. I actually, every day when I was in the hospital, I didn't get out of bed for 4 months. So they would come in every day, change my wound, and it was literally almost in my crotch on my right leg. I couldn't see them working on it, so it was pretty painful, very painful. So to take my mind off, I would ask them questions, the wound care nurse or the physician when they came in. So finally, the wound care nurse went and bought a mirror, propped it up so I could watch what they were doing, including the doctor. And I learned.
I think he locked up again. Hey, Violets and Bulwarks. You got people that just came in. You guys are going to have to bear with us. Chuck is on the road. So he locks up. I'm going to be honest with you, Chuck. It's kind of nice not being the one locking up all the time.
Yeah.
Because usually it's on our end.
I'm not at home. I'm out of town. So
you know,
the internet is not the best.
I worked at a level 1 trauma center, IT, for 17 and a half years. So, you know, I made my way around. I was where they were giving treatment stuff. And the two things that always used to amaze me, the amount of gauze that was left on the floor of the ER after they worked on somebody for an hour, hour and a half, and then how much wound care stuff they went through on the inpatient recovery ward.
Yeah.
You know, and and we were level 1. We were in a major metropolitan area, and so I actually, one of the guys that worked in the ER was a combat medic and did 2 tours in Iraq, and he said that working it was in Kansas City, it was a Truman Medical Center, and he said the only thing that working in that hospital did not prepare him for was all the traumatic amputations, but the gunshot wounds, the knife wounds, and all that other stuff, he saw more of it at work in Kansas City than when he was in a combat zone. You know, but it always used to amaze me how much stuff they went through.
Yeah, and that's what's going to kill you. You may stop the bleed and you may properly do all that, put a tourniquet on, pressure dressing, stuff like that, but then you've got to take care of that wound. You may have to take care of it for a month. In 2 hours, just like you were talking about your friend, within 2 days, he's on life support. That happens every day because of poor wound care, poor sanitation. It's simple things, and that's what I really try to push because, you know, when you go to a doctor, sometimes you feel like he's speaking to you in Chinese the whole time. And the medical society has fooled us all to think all of this stuff is magic and it's real technical. It's not. I do it. I've done it for 29 years. I've made it a career. All right. Believe me, I can teach it. And I've taught for over 20 years. I've taught EMT class, paramedic class. I've taught foreign nations and foreign nationals. I've taught at a med school. So it's easy to do, and I enjoy teaching just a person who has no medical knowledge and who wants to learn, instead of the medical professional who's doing an in-service and they're just there because they have to get the hours. I love the people who are eager. When I went to Jason's, we had a small group, and that's still one of my favorite classes I've taught, because and all my classes, I do a real laid back, it's more practical than tactical. And that's what I do. I can do the tactical cool guy ninja stuff, but I like to do the more practical things, that where you learn something valuable that can save your life, your loved one's life, your group's life. All those things I feel are just extremely important. But the common person, and even the common person who's in the prepared mindset and who is making the journey of being prepared, they don't have that training. They don't have the supplies. And that's a big part of my class is we go over, what do you really need? What equipment do you need? And what are you going to use? And what you truly need to be prepared for.
Jason says you like being there just because of the brisket he cooked.
Yeah, the brisket was really good. Yeah, I did, because I think I gained about 5 pounds at Jason's in that weekend in 2 days, because he fed us immensely. And everywhere I go in the classes I teach, everybody is just every class I do, I'm just more excited to do this and coming up with more things. And this whole network we have of through Self-Reliance and through Midwest and now through Jason's Festival, this whole big network that we've created. I've met so many contacts, and I'm doing a collaboration with somebody. I don't think we're ready to release it, but he's in this network, and he makes some equipment, and we're working on something now. I've done collaborations sort of with John, and I've taught stuff, and like right now I've got kits that are pre-made that are fill kits for John's equipment, and I love doing that, and I love being able to network with these people and push these small businesses who are a part of the network as much as I can. I drink Nicole Sauce's coffee. It's all the different people. Your food. Anytime anybody talks to me about freeze-dried food, I said, if you don't want to make it, this is where you need to go. Go to Grumpy Acres, buy their stuff. You push everybody in this community. I just think it's extremely important that we support each other and we push each other and take advantage of, if we do have trainers, whether it's firearms or whatever, that we do this.
Well, Jason and I were having a conversation one time, and I had sent some people over there after one of our lives to because he was doing his live, and he thanked me for it, and I was like, dude, you got to thank me. We're here to make each other succeed, because when you succeed, when he succeeds, when local preppers succeed, when all these people that are in this niche succeed, we succeed, right? It just makes everybody better. Now, you mentioned your pre-made kits, and like I said, it's expensive to fill those holes. Do you have any suggestions for anybody that's watching for inexpensive ways to fill holes? Because I was looking at Temu just for some reason. I was out there and started looking, and they've got the Chinese tourniquets for $4 a piece. Somebody goes and buys that stuff. Is it going to do what they need it to do?
Well, here's my thing. No, it'll break. You're going to die. It won't do. There's 2 tourniquets I recommend, and before the haters and some of the group, they're going to mention other ones. A windlass tourniquet. That is your first offense. A CAT Gen 7 made by North American Rescue, or a soft T tourniquet made by Tactical Medical Solutions. That's what I carry every day. I just pulled this out of my pocket. I carry med on me every day, and everybody here should. Do you carry a firearm like you should be able to, like you do, like as your right that you can? If you carry a firearm and you're not carrying at least a tourniquet, you're stupid. But here's my other thing, Grumpy. How often do you use a chainsaw on your farm, on your homestead?
Quite a bit. Quite a bit.
Do you have a tourniquet? How often are you using that chainsaw by yourself?
Guilty. I know where you're going. I know where you're going with that. I am guilty. I do not have a tourniquet out there with me, and I should.
I've got a small, I developed it. I did a little lecture John hosted that chainsaw workshop that Chris Watkins taught, but I did a little medical portion, a little stop the bleed thing. But I've developed a small chainsaw kit that has a tourniquet, a small compact pressure dressing. I mean, I can. Here's the thing: everybody says, "Oh, I can't carry all that on me." I just pulled this out of my pocket. All right, this is a full IFAC. There is and I'll show it to you. There's a pressure dressing. There's wound packing gauze. There's a nasal airway. I even have duct tape because duct tape fixes everything. I put them in every single one of my kits that I sell. I do. I put duct tape in everything. I've got a chest decompression needle, gloves. There's no reason why you shouldn't be able to carry, because all of these things that I'm carrying, if you don't treat it within 5 minutes or less, you will die. Mm-hmm. I've got chest seals. All of those things, arterial bleeding, you'll die in 90 seconds, you'll pass out from blood loss. You won't be able to do anything. Within 3 minutes, you'll bleed out, you'll be dead. Your tank will be empty from your body. Your blood is your tank as it circulates through in your body. You'll bleed out, you're going to be dead. Chest seal, if you have an open chest wound, a sucking chest wound, you don't cover that, you'll be dead in 5 minutes, because that air is going to keep filling up in your chest cavity within your pleural space. It's going to push against a lung, whichever side it's on. And then once that lung is deflated, it's going to start pushing against, guess what? Your heart. Your heart won't be able to pump. It won't be able to fill up with blood and then contract it out. You're going to die. A simple chest seal will fix that. I carry this every single day with me. Either it's in this kit or I carry an ankle kit on my ankle, with my pants every day. I don't leave home without it. When I at night, when I take my wallet out, this tourniquet, if I can get it out of my pocket, this tourniquet sits on top of my wallet. So I'm not going to leave the house without my wallet. I'm not going to leave the house without my tourniquet.
Hang on a second. We got escape goats and the dogs are running back in. Make sure nobody gets hurt. All right, they're good. Yeah. Okay. So that's the trauma stuff. What about the long-term care stuff?
So long-term care stuff, some of the stuff that you should have is stock up on gauze, but like some of the alternate stuff that you can have, a lot of people go, well, I can't get antibiotics, or I'm not going to have this, or even say you run out of triple antibiotic. Or honey. Do you have honey? Honey lasts forever. That has been used as a medicinal for wound care, open wounds, for thousands of years. Learn about your herbal medicine. You've got stuff growing in your backyard right now. There's a couple of books I'm reading. I'm learning more about herbal things now. I mean, you all grow a lot of stuff now, making tinctures and stuff like that. Yeah. That stuff works. Trying to remember a book. There's a book called The Herbal Medic by what's his name? Sam Kaufman. It's on Amazon. You can get it. Herbal Medic. That's a great book. Herbal Antibiotics and Herbal Antivirals by, I can't remember his name. His last name's Bauer.
You think after we're done here, you can send me an email with some of these suggestions so I can drop them in the show notes or the description down below?
Absolutely.
Okay. I think people would really appreciate that. Now, Starla made a comment. I held off showing it because I knew we were going to get to it. She made the comment, the Mennonites use clean white material cut into strips and rolled up like gauze. That is what I have been doing and sealing them in plastic. Is that not good enough to supply my supply? Is that something somebody could do?
Last ditch effort, yes. Here's the problem. Was that sterilized before you put it in there? Because you got to remember, that is what's going to be going. You may be using that material to pack into an open wound. Whatever is on that material, if there's any germs, any bacteria, anything, once you put it in that wound or over that wound, it's going to be in your bloodstream. Now, if your body is not strong enough, then your natural immune system to fight that off, you're going to get septic. So I always say gauze is cheap. Buy the gauze. It's cheap. Buy 4x4s, 2x4s, gauze rolls. And if you want to do a group buy or something like that, contact me, I can facilitate that, because if you buy in bulk, obviously on anything, you can do that. Jason's group has bought a lot of medical supplies in bulk, and I can facilitate that. I can build anybody a custom medical kit. It just depends on how much do you want to spend, But as far as backup items, yeah, you can, but I would just be very cautious about the linen. If I don't have anything, yeah, I would use the linen stuff. How she's storing it is a good idea, but prior to using it, I would probably boil it in water and let it dry first in the most clean, unaffected, sterile way that I could. So you're not getting, because bacteria is floating around in the air right now.
Oh, yeah.
As we're speaking, bacteria is coming out of our mouth. You rub your hands together, bacteria is coming off your skin. This dead skin cells have bacteria in it. Your body sheds bacteria. Every time you breathe and you exhale, you're removing all the waste out of your bloodstream. Believe it or not, that's how the exchange goes. So you're breathing out bacteria from your body. So I would just, if you can, buy gauze. Even if you only have $5 a week, you can buy a lot of gauze for $5.
Okay, so there you go. You what's that called? The cost average or something like that, where you buy a little bit at a time.
Set a budget when you go to the store or where you go, whatever. Now I can buying it at the Walmarts, the grocery store, stuff like that. It's pretty. The cost is a lot more. You're going to pay a lot more. You can do a lot better by looking at some other places. I could tell you. I'll answer Deborah's that.
Okay.
Thing. No. No. You pack a wound. Okay. Not trying to get too explicit, but what does a tampon do? It soaks up stuff. You got to remember, if you've got a hole and you put a tampon in and plug a hole, say a gunshot wound, a stab wound, a puncture wound, all that's doing is preventing the blood from coming out. It's not stopping the blood. You're not at the point of where the bleeding is. Okay, so if you're in the arm, you do that. That blood's got somewhere to go. Guess what it's going to do? All it's going to do is just fill up the cavity in your arm and around the skin, and then you're going to have what's called a compartment syndrome. And then you're not going to be able to treat that because you're not going to get quick enough to a surgical unit, and you're going to lose your arm, or you lose your leg. Or if you put it in your abdominal area, how big is the cavity of your abdominal area? You can lose your whole blood volume in your abdominal area alone. Mm-hmm. So do not do that. Sanitary napkins, could you use those as a bandage, a covering? Yeah, you could, but not to stop emergency bleeding, not to stop an arterial bleed. And there's a difference. And that's why I say take training so you can recognize the different types of bleeding, whether it's capillary, venous, or arterial, and which one's going to kill you and which one probably won't.
Yep. I always wondered where that wives' tale about the tampons came from. I first time I heard it was, gosh, it was back in during Gulf War. It was the first time I heard it. But I'm sure it's been around longer than that. But I'm glad. I'm glad, Deborah. I'm glad you asked that question.
Yeah, that's a great question, and that happens a lot. And I'm glad you did, because I want to please nobody throw the tampons out of your medical kits. Throw them away, burn them, give them to your wife. Whoever.
Well, don't get rid of them because they.
Yeah, don't get rid of them. Just get them out of your medical kit. Let's not think that. Sanitary napkins, yes, you could use that as a backup dressing, but buy the stuff and if you're on a budget and you're not sure where to do or how to begin for medical prepping, call me, email me. I will call you. It's not going to cost you anything. I'll talk to you all day long. We can come up with something that either I can help you, or at least I'll point you in the right direction of supplies to gather so that you are prepared. But your first step, you can have all the supplies in the world. You could spend thousands of dollars. Do you know how to use it?
Right.
I know people who have full surgical sets and all this equipment and everything. They've got blood pressure cuffs off. They can't even take a blood pressure. What good is it going to do you?
Right. Absolutely.
That's like buying a bunch of firearms and never buying any ammunition.
Okay, so we were talking. You mentioned earlier we were talking about medications, and I had somebody wanted me to ask you about the natural remedies, and we kind of touched on it a little bit. Um, going a little bit deeper into that, are there any caveats that you can think of when it comes to natural remedies? You know, as far as efficacy or possible not poison. What's it called whenever you overdose on something?
Yeah. I mean, it's an overdose. You can have toxicity from
Toxicity.
plants and from some of that. So you've got to be very careful. My suggestion, just like anything else, educate yourself. Read books, take classes, get with people who know herbal medicine a lot better. Be very careful of going to buy a tincture or a salve or anything like that from somebody you don't know. Just because you're at a farmer's market, do you know these people? Do you know if they're on the up and up? You know, keep it within this network. I mean, I would much rather, if I'm going to buy any comfrey salve from anybody, it's going to be from you all, or I'm going to buy it from Billy Bonds or something like that. I use it. I keep it in my medical kits now. It is great for burns.
Mm-hmm.
I'm keeping that stuff because it does work. A lot of it does work. And let's be honest, guess what they were doing thousands of years ago when they didn't have all the sanitary things like that? They were doing this. That's why I say honey. People look at me like I'm nuts when I talk about honey for wound care. They're like, what? Why would you put honey in? Well, they were doing it 5,000 years ago. That's why you do it. And honey, you can keep forever. You know, it doesn't go bad.
If you listen to the pharmaceutical industry and the medical industry, it makes you wonder how we survived all these millennia without them. You know,
if you do a little research on some of the in Egypt and places where they've uncovered, you know, mummified bodies and
uh-oh, he logged up again. So we are talking with Chuck. Chuck is on the road. If you weren't here for the first lockup, he is on the road. So his internet is kind of spotty. So we're having to deal with the internet. We're talking about the natural remedies. I'm gonna say this. So one of the drugs that I'm on was metoprolol, and if you're on that, go look at the side effects. The side effects are just as bad or worse than what it's fixing, and I started, like Chuck said, I started doing the research, and metoprolol is a statin, and it's a B statin, and you can get the same type of results by using A statins, which are all natural. You know, talk to your doctor. I'm not a medical person. I'm not giving medical advice, but you can learn this stuff and learn how to take care of this stuff by yourself. Okay. While we're waiting for Chuck, if you got any questions, go ahead, do me a favor so that I don't miss them. Go ahead and put question in front of your question, and then type it into the comments. Okay, you were talking about. I don't remember where you were, Chuck. I got busy trying to follow up on what you're talking about.
About honey.
About what?
Honey.
Oh yeah, honey. You were talking about honey 5,000 years ago.
Honey's a great antibiotic. I mean, there's so many different plants and stuff out there that have. I mean, all of our medications. Guess where they come from, and they start from, and they're derivative of. It's plants. It's flora. Mm-hmm. So you know, I'll send you these books that I recommend, but really start looking at, because you can grow this stuff inside. You don't even have to be outside. You can grow it by a window in a little box where you can grow some of these stuff that you can have your own herbal, garden to where you can make tinctures and stuff like that. Get with the people who know how to do this. Look locally and see if there's classes and stuff. You know, I used to call them, oh, the hippies are doing, their little gathering. Well, now I'm going to the hippies classes because, when you look at it, do your research. They were doing this hundreds of years ago, if not thousands of years ago. So why wouldn't you have that as a backup? You know, I always look at everything as a PACE plan. You know, have your primary, your alternate, your contingency, and your emergency. And have those backups, because eventually, if you can't get to conventional medical care, do you only have a 30-day supply of your medications? You know, what are you going to do if that look at Hurricane Katrina. Does anybody know how long before there was a hospital up and operating in New Orleans proper? The only hospitals were there in the Gulf was the hospital ship Comfort and Mercy that came up from the military sent up. That was the only hospitals in that area. When I was in Puerto Rico, I was the chief medic for the recovery effort down there for Hurricane Maria. There wasn't hospital access for a month.
No. Okay, I'm sorry. Can you hear me?
Yeah, I can hear you.
Okay, Yoda's sitting over here off screen, pointing at me, trying to get my attention.
Hurricane Katrina, when they ran out of medicine,
Uh-huh.
they actually seized an entire farm in Lawrence. She's a natural herb.
Oh, that's right. So she's over here. She reminded me during Katrina, whenever the medicine was getting short, they actually came here to Lawrence, Kansas, which is not too far away, and seized all this lady's product and took it down to Louisiana.
Yeah, and you know, let me explain something to you. I've worked for FEMA. If you think FEMA is going to be there in 72 hours, you're obviously ingesting and smoking the wrong type of herb, because it ain't going to happen. I was part of that response. It isn't going to happen. They don't even have their act together for about 5 or 6 days before they can figure out who's actually in charge because they're bidding. So be prepared. I mean, that's all I can say, and that's especially for disasters, tornadoes, hurricanes, all of it. You've got to be prepared for this stuff, and everybody in this community. I feel like I'm kind of preaching to the choir, to the people who are watching this live, because a lot of them are well prepared. But Jason was in here earlier. I don't know if he still is, and I don't want to go too much into his preps or break any of his security, but he's well prepared. And I was very impressed with his medical preps alone, but not just his medical preps, his overall preparations. And I highly encourage you to get into groups, mags, and learn from each other and do these things, train together, so you are prepared. Because I'm telling you, if you haven't figured out that our medical since the big C hit and we had all of our stupid lockdowns and all that, did you see what's happened to our conventional medical care? It hasn't gotten any better. It's worse. If you think you're going to go to the ER and get treated quickly for an infection, it's a good chance you're going to become septic while you're in the waiting room.
Right. Yeah, and you just mentioned something. When I was in the Marine Corps, it was in the late 80s, early 90s. We had one corpsman per platoon.
Right. And
I was just reading something the other day. After the invasion of Iraq, the military started understanding that they needed more initial responders, so they came up with you've got your combat medic, you've got your combat lifesavers, which are just more trained than your regular infantrymen, and then you've got your battle buddy, and everybody down to the individual rifleman is trained to be a combat lifesaver.
Yeah, and you really should do that for your group and have this basic medical care. But I highly encourage everybody, and I'm not saying this promoting my class. I'm saying this. I highly encourage you to become more prepared, because it's a good chance you're going to stop the bleed. And then what are you going to do? You're just going to sit there and look at it. Now what do we do? You're going to have to take care of that patient. And it's not just wound care. It's patient assessment, the signs and symptoms. But what if somebody has a medical problem? What if you have a 74-year-old female in your group who gets a UTI, urinary tract infection? Do you know that in the elderly from 70 above, once they get that, that's a serious illness. That can kill them. A simple UTI. Cranberry juice ain't going to do it. You've got to know how to treat those things and alternate treatments. It's stuff like, what if you have somebody who's severely septic? Do you have the supplies? You can get IV supplies. You can get the IV catheters, the tubing, and the fluids. But here's the other thing. In my class, I'll teach you how to make saline.
Excellent.
So it's all these things you have to be ready for, but everybody should be trained to a level, and then you have layers. And that's something I'm doing now, a video series on my YouTube channel, is your layers of medical preparedness. I've done mindset and I've done training. My next video coming out is your everyday carry what you should have and why you should have medical on you and be prepared, but it's probably not what you think. You know, so exactly what what Spags is saying here. FEMA's not there to help you. I mean, remember what Reagan said. You know, the most scariest words you can hear. I'm from the government. I'm here to help. Believe me, I've seen it. That's why I don't work for FEMA anymore. It's a joke. They're not here, and FEMA is becoming more militarized. And you need to be prepared. And here's the way I look at it: you're a grown adult. Why wouldn't you be? You're going to rely on somebody else if something happens? That's ridiculous. If you're in that mindset thinking, you've already lost. You're going to be part of the statistics. You're not going to be part of the people who thrive. You'll never go anywhere. You won't last a week.
Okay, so we're almost an hour into this, and we've been talking about Homestead Medical stuff as it pertains to the way things are right now. You get a tornado, you get a hurricane, you have an accident on the homestead, you need to stop the bleeding, you need to do all that primary care, and then you need to be able to take care of people after that.
Right.
Let's take it, since our channel is not only about homesteading, we also talk about preparedness and like post-apocalyptic type prepping stuff. Let's take this one. Let's kick up the notch of what happens if the infrastructure and the medical system goes completely away. Now, I asked you, one of the things I wanted to talk about tonight was your thoughts on ditch medicine. I'll tell you, one of the most important books I've got in my library is Where There Is No Doctor.
Yeah, I've got that, and Hugh Coffey's ditch medicine book. I don't know if it's out of print, it's hard to get, but if you could get a copy of the actual ditch medicine book, phenomenal. That's my Bible. When I've worked, because I've worked in austere environments around the country where I was the only medical provider. I was the highest medical care for, in a 100-mile radius that anybody could get to. So I used that book extensively. I cherish my copy that I have because I don't want it to fall apart. But Where There Is No Doctor is another one. I mean, I can send you a list of books I also recommend that everybody get and have in their library. And I'm not talking digital copies. Buy the hard copy. Have that hard actual book. When people used to read books, in your library of preparedness.
Well, and one of the things that we're big on, you always hear us talk about community and everything, and the big thing about where there is no doctor, and I'm sure it's in other books too, is the fact that building a community clinic goes a long way. And yes, you want medical people to run that clinic, but if you don't have medical people around, how do you create something like that?
So to do a clinic, I actually go over in my 2-day and more expensively. I can do a full 4-day class, or I can break it up into two-day sessions. But I actually go over on that pretty extensively how to create your own medical clinic, the equipment you need, the training you need, and why you need it. And it's extremely important. I don't want to break Jason's security, but let's just say he's one of the people who's doing a clinic. There's other people in the community that are doing that, and they're actually preparing having a community clinic with that. And I've consulted with them and done stuff and done training. And like one, I went up and did a live tissue lab. They wanted realistic training as much as possible.
Wow.
And we did a live tissue lab with a live fire course on it. Yeah, it was a tactical cool guy ninja stuff, but we also did a one whole day where we did nothing but live tissue treatment on many different things, so you could see actively what was going on, how to treat it, and it woke a lot of people up. And they saw some equipment that they were carrying fail.
Mm-hmm.
You tested on the equipment. So having a clinic is important because, and then what are you going to prepare for? How many people could be in that clinic? Let me tell you something. You have a breakdown of society, here's one thing you need to also prepare for is death, a morgue. How are you going to dispose of the bodies? Because I promise you, people are going to die. Medications aren't going to be available. These things aren't going to happen. And the simple things, because people, they panic. So the first thing they forget about is, I like to say, is everybody starts trying to live like an animal. They forget about sanitation. They forget about clean water. You know, if you're prepared for that and you practice these things, you're going to be ready. Do you stock up on soap? Do you stock up on dish? You know, Dawn liquid dish detergent, you know, dish soap is a great thing. You can bathe in it. You can clean with it. You can disinfect with it. That's a cheap way of building up a prep. It's things like that, because people will die, and then you've got to have supplies. It's expensive to do a clinic. That's something I would suggest, if you have a true community or group, that you get together and you work on doing that. Put your group buys and your medical supplies into that, because guess what? You may never use your firearm or your tactical training or your chest, you know, your plate carrier. Should you have them? Yes. Should you have the training? Yes. What I promise you, you will use, and I promise you that will happen, is medicine. There will be medical problems, whether it's big or small. Somebody will be sick, somebody will get hurt, and you will have to take care of it. And that's given. And here's the other thing that happens too in a grid down long term. Babies get born. You know, and are you prepared for childbirth out of a hospital setting? Do you know how to do it?
Yep. That's one of the that's another one of those where there's no where there's no doctor, where there's no dentist, and where there's no midwife.
Right.
There's three titles right there.
Childbirth is easy. Believe it or not, it's easy. You don't do a lot. You catch. It's once you catch, the few steps you need to do, because look, childbirth's been going on since the start of civilization. People live through it. It'll happen. It's going to happen. But you need to be prepared for it, and be prepared in case something happens, because it may not just be the baby. The baby may be perfectly healthy. The mom may be compromised, and you may have to treat that. So you've got to be prepared for so many things. It seems overwhelming, and it can be, but if you're smart about it and you chip away at it a little by little by little, and each person in your group gets in, you could have a really well-stocked, well-prepared home clinic. And I'll be more than happy, even if you wanted a class on just a day-long class on how to build a medical clinic and what we should have and what we should prepare for, I'll do it. Or a consultation or something for your group. You know, I highly encourage it. And, you know, if you offer me the right stuff, I'll come to your group and I'll be your medic for your group. But, you know, I've got to have eggs and food, and, you know, we're going to have to talk, negotiate and stuff for me to relocate.
Okay, I'm gonna say something that's probably gonna upset some people. So one of the things that people always try to add to their group, their mutual assistant group or their community for the end of the world, is a doctor. You guys got to be really careful, because we had a friend who was a trauma doctor, one of the most well respected trauma doctors in the Midwest. And he was a military doctor, and he was extremely knowledgeable. We started talking about ditch medicine. Number one, he didn't even know what it was. He had no idea what I was talking about, and he was quite capable. He gave us a class, a really good class on suturing. We used chicken thighs and pig's feet to do the suturing class, and he gave a great class. But he didn't. It was out of his wheelhouse to think about ditch medicine and doing it in a very austere condition, you know. And I'd almost say at that point, I would rather have a combat medic on staff rather than a full-blown MD, because at least then they've got experience in doing medical in a environment like what you're going to face after the stuff hits the fan. You know, am I wrong there?
Yeah. No, you're very right. Can you hear me?
Yeah, I can hear you.
My internet's
Yeah.
acting up or not.
You said yes, agreeing with me right after I said, "Am I wrong?" You went yes, and then you froze, and I was like, "Ooh, that's not good."
No. I agree with you. Here's the problem with. I could walk into a hospital right now and probably grab half a dozen doctors, and maybe half of them can actually apply a tourniquet. Maybe half of them have seen a tourniquet, believe it or not. And you got to remember, a trauma doctor, you think, oh, he's a trauma doctor in a hospital. Okay, what's he used to? You worked in a trauma center. When the doctor walked in, how many people were in that room?
Oh God, at least 10.
So imagine now, take that doctor out of the ER, put him by himself with one sick person trying to work on somebody. A lot of times they panic and fail because they're not used to it. They're not used to doing everything. That's why and I'm not saying this because I'm a paramedic, but I am saying this because paramedics are used to working. You're the only one in the back of that ambulance, and you're doing the same thing a trauma room is doing. You're just doing it in the back of a moving vehicle that's the size of a closet. You're going over our wonderful roads in the U.S. to get to the trauma center where you're going to hand off to 20 people. Independent duty corpsmen from the corpsmen from the Navy are great. 18 Delta medics, from Tier 1 units, great. Mm-hmm. Pararescue from the Air Force, great. Those are great resources. But you get your doctors, they need to train. And a lot of times, I've seen doctors where I've gone out, and when I worked overseas, we had some doctors come over who, they weren't used to that. They were used to very few options and resources of having to work by themselves.
Right. I think if I were to choose a discipline that I would want in my group or in my community, I think a general practitioner or a nurse practitioner would probably top of my list. Beyond that first the medic level training or paramedic level training. I think a GP or a nurse practitioner would probably be the people I'd want most. Okay, let's see what Jeremy says. I'm seeing two versions of ditch medicine. One is significantly more costly than the other, but they both have the same titles. Which one do you have? Uh-oh.
Which one do you think, Jeremy? Fortunately, it's the one that costs more. It's out of print right now. Invest. I don't know if you can hear me or not. If my internet's still acting up.
I think you said invest in the more expensive one because it's going to be better for you. Oh, dang! $500. Seriously?
Yeah, it's the expensive one. Yeah, it's out of print. I mean, if that tells you, if you could find a Hugh Coffey is the author. I'll stick it in the chat because I've got it on.
Okay, well, he's doing that. I'm going to say this. This is what I used to do.
If you find that one from Hugh Coffey, that's the one you want. It's well worth investing in.
Now, here's something I used to do, and you could call this shady if you want, but I'm a big believer in using the library. And so you find these titles that you want. Number one, you can test drive them to see if you want them in your permanent library. Get them through the library. Number two, keep checking them out and keep reserving them, the titles that you really want to stay in your library, especially if you live in a small town. That way, if something does happen, you can go to the library and grab the books you need. I think after the balloon goes up and everything's falling apart, I don't think the library is going to be coming after you for past dues if you've got these books at home when it happens. I don't think.
I'm a big proponent of self-education. Teach yourself. Get audiobooks. Jeremy, I know, is a truck driver, so he's, he obviously can't read while he's working, but he can listen. Get the audiobooks. You can learn so much by just self-education. Do yourself a favor, be a grown adult, and teach yourself. Um, so, I look around, find Ditch Medicine by Hugh Coffey, find, where there is no doctor, where there is no dentist. And I'll send you my list of books,
Okay.
G, that you can post in the show notes afterwards. And the
I'll
authors
probably
and
put it in.
So
I think it's probably going to be better putting a community post. That way everybody can see it directly,
Yeah.
not have to go find the video and stuff. So I think that's where we'll put it.
Yeah, I'll do that. But, I just can't stress enough. Take training, invest in yourself, because medical is so important. And I'm telling you, the grid goes down. We have some sort of societal failure. That's what's going to happen first. That people are going to die, and they're going to die needlessly because they just simply weren't prepared medically. And simple illnesses like a cold are going to kill people because they're not going to have simple things like they didn't stock up on Allegra or anything else.
Mm-hmm. Yeah, Rabbit Coyote just posted Doc Bones and Nurse Amy. Their book is a good base level book. It's in my library. Yeah. Okay, so we have talked. Let's see. We've talked about the Homestead Medical in good times. We've talked about the natural medicine, some of the holes that need to be filled. We've talked about what we can do, or some of the hurdles that we're going to have after the system falls apart, trying to do the medical stuff. The last question that I had was, we discussed these consumables, the gauze. I guess the first part of the question is, what are some other consumables that are really high on the list that we should be looking for before SHTF? And then once those consumables are gone, what are some good alternatives for them? Right? Because you mentioned gauze and you mentioned making your own saline. Those are two big ones. What are some other ones that people can look for?
Well, OTC meds, and then once the medicines runs out, that's when you're going to go to the herbal medicines. Have that backup, have the tinctures, have the salves, have all those different things that you could have prior. Have the ability to make your own bandages and learn how to sterilize them, how to properly treat them. Simple things like properly treated water are huge.
Mm-hmm.
It's hard. You can make a splint out of anything. In my class, I teach you how to make a cast with a couple of SAM splints and some duct tape. You just got to stock up on things, because I don't know of anything that's going to, that's a substitute for duct tape, but I do know that there are some medications that you can go to herbal medicines and things like that that can substitute. Now, will it be as effective? Will it have the same told? And when I say a told effect, it's basically a technical term of how the medication reacts in your body that is manufactured. It may not, and you may need to have dosages. Here's the other thing. I know a lot of people where their fish get sick, and before they used to be able to get it before June 11th when they checked it out. And you probably have a lot of medication for your fish. Mm-hmm. You got to convert that because you may have a fish that weighs 185 pounds. So you're going to have to convert that to work. And that's something else. I may or may not have something that may be coming out soon that has some of that information.
It's good. It's good you say that, because living on the homestead, we've got these animals, so we've got stuff like sheep drench. We've got sheep drench for deworming.
I know a lot of people have gotten ivermectin, horse paste, and they have it for their animals. There's been talk that some humans may want to use that. Some people may want to use that for their own treatment. I may or may not know the dosage that you would need, and how many milligrams of that you would need, and how to convert that for use. So it's learning things like that of supplies you already have. But I would just stock up on the OTC meds, the gauzes, the consumables, as many consumables, because I promise you this. Right now, your most used most used supply in your medical supplies is a Band-Aid. Buy as many Band-Aids as you can. You know, yeah, I know. If Jason's in here, he's gonna give me the typical contractor answer. Oh, I'll put some electrical tape on it and stuff. Well, do you know that duct tape and electrical tape, the adhesive that is in that makes it stick so well, is actually caustic to your skin? In other words, it's poisonous to your skin and to the flesh on the inside, and there's a good chance you could get an infection from using that.
From electrical tape?
Just like super glue. People say, "Oh, I'll super glue it shut."
Oh yeah.
Look, there's skin glue and then there's super glue. The super glue is actually going to burn the flesh on the inside, could cause more damage, and you get an infection. You know, could you use it as a last resort? Yes. Would I recommend it? No.
Yeah, that was one of the things I got in really tight with the wound care nurses there at Truman, and I went in with a wound that I did not treat properly, and I got a very long lecture about proper wound care. So I am all about it. I would say one of the big things to stock up on. I love that the silver impregnated moleskin. I love that stuff.
Yeah. Oh yeah. I'm just gonna bring up a list of stuff that I would. Some things you may not think of. You know, dental kits is another big one. Stock up on that. I'm telling you, clove oil and things like that, and get the little putty. You can buy them for like $2, and it's a little thing that will fill about 4 cavities, and it's a dental putty. It's cheap. You can buy them at any pharmacy. Stock up on that. Let me see here. Another thing is bug bites. You know, what about ticks? You know, if you get a tick on you, you could get, you know, some serious illnesses that ticks carry. One little thing I'll take a soapy cotton ball, put it over the tick. It's going to release. It's going to come out and come out of the skin instead of trying to pull that tick out, because you may leave the head end, and then you're going to be guaranteed an infection.
One of the guys in our group had one of those. I said one of the guys in our group had one of those tick keys, where it's just got a little loop of metal. I'd never seen one up close and seen one in use. That thing's pretty darn neat, you know, and it worked every single time.
I saw a guy. This happened in Puerto Rico. He got a splinter. It was a lineman, one of the power guys, restoring the power. He got a pretty good splinter in his finger. He let it go. Didn't really take of it. Big tough guy. Didn't care. Well, we sent him off. His finger turned gangrene. Let's just say in 2 weeks. He would wrap it up with tape like a stupid contractor. No offense. And we had to send him. We had to medevac him off the island. We had a jet come in because we already had this prearranged. It's part of our plan. A medical jet landed. We got in. We flew. One of the medics went with him to Miami, and he had to have emergency surgery. He lost his finger, and he had to stay in the hospital about 10 days getting antibiotics because he became septic from a splinter.
And at the end of the world, that would have killed him, right?
Absolutely. He'd be dead. Hydrochloric chloride dressings. It's got the silverdine and stuff in it. They're great for burns. Stock up on that. They're fairly cheap. Peroxide. Peroxide's a big one. Stock up on that stuff. It's cheap. You know, just the little things like that. Alcohol, rubbing alcohol. How expensive is that? Stock up on it. You know, I know some guys would rather stock up on vodka and just use that as their rubbing alcohol and stuff. But, you know, that's up to them. But it's little things that you should stock up on. But a lot of people don't think about this. Gloves, medical exam gloves. You got to remember, our hygiene and our cleanliness is going to suffer. So stock up on those things where you can stay clean as much as possible, especially when you're treating wounds. Yeah, betadine. I was getting ready to mention that. Thank you, Jeremy. Betadine is another one. All these things are extremely important to have, and you need to stock up on it. It's not real real hard to have.
Chlorine's another one.
Oh yeah, absolutely,
your bleach,
absolutely.
chlorine bleaches and finding alternatives to the liquid stuff is really simple.
But a lot of Benadryl, not just for allergic reactions, but Benadryl can be used as a sedative. There's so many uses. There's secondary and even tertiary uses for over-the-counter meds. So there's just so much. We could talk about this for hours. There's so much crap you could go into.
I'm not going to say that we haven't used Benadryl to put the kids to sleep when they were smaller, but it was always an option. But yeah, we could go on.
You've got to you've also got to remember that you're going to have people who are going to panic. That they may go manic, they may go get excitable, have excitable delirium. You need to have something that may have to calm those people down. So having these for these alternate uses for things and knowing what these alternate uses are. There's other medications too to do it, because you don't want to run up and pop somebody because somebody been storing some Valium and you want to throw a couple Valium into somebody, because how do you know they're not allergic to it? How do you know that they shouldn't have it, or they're taking medications or have something where they could have a counter reaction to it and that could kill them?
Right. Well, and there's something else you kind of touched on the side of it. We were talking about being on the heart meds, but there are a ton of people, especially in the United States, overprescribed on psychotropic drugs.
Yeah,
and if everything goes away, oh my gosh, that's a nightmare waiting to happen, man.
Well, the other thing you can do is improve your health now while you can. Simple things like make sure your body stays hydrated. Americans are the worst worldwide. We're always this far away from dehydration because we like to drink the sodas and the teas and the energy drinks, which are the worst thing in the world. If you drink energy drinks every day, do yourself a favor. Stop now. The coffee, which I'm guilty of. I drink a lot of coffee, but make sure you drink water. I carry this water bottle with me everywhere, and I drink 4 to 6 of these every day. It's 32 ounces because to keep your body hydrated. Simple things like hydration improves your health and keeps you healthy and keeps you on that midline so much by just drinking water. Your body needs it and exposes it. You can get dehydrated by just sitting in a relatively timid climate like 70 degrees. Your body dries out quickly. There's so much that and multiples that play into it. So it's little things like that. Just take vitamins every day. Try to get yourself as healthy as possible. Exercise, get in shape. And believe me, I'm definitely not the picture of being in shape. But those little things too can really help when it comes down to it.
You're talking about the getting dehydrated and not knowing it. We were at the Homestead Life Festival and it was overcast, and we were sitting underneath the sunshades, so we were not getting any direct sunlight. It was really no direct sunlight, but those UV rays, and there was a slight breeze blowing through all day long. And Darren from Hacks from the Homesteader and I were talking, and by the end of the day, you could tell that people were dehydrated. And I'd been sucking water down.
Here's the thing: you want to know how you're dehydrated?
How's that?
When you're thirsty, you're already behind the curve. If you say, "Oh, I'm kind of thirsty, my mouth is dry," you're behind the curve. You should drink. Technically, what the doctors say is you should drink 64 ounces of water a day. That's 8 ounces, 8 glasses of 8 ounces of water a day. I drink, this water bottle holds 32 ounces. Like I said, I'll drink 4 to 6 a day, depending on how hot it is, what I'm doing, stuff like that. And if I'm doing strenuous activity outside and I'm sweating, I'm very conscious about that. But the other thing is, you got to make sure you have your electrolytes. You got to make sure you're doing that and you're prepared because your body needs those electrolytes. Because if they don't, you get an electrolyte imbalance, believe it or not, that can kill you. Because then that starts affecting your heart. because your heart does have electrical activity in it. And those electrolytes is what helps promote and keeping your heart stable, and what those synapses and things that are doing, not only in your brain, but the electrical activity in your heart that keeps everything moving like it should. Those nerves that are in there that are firing off. So, you have to, those little things like that are extremely important.
Yeah, and prepping for electrolytes is probably one of the simplest things you can do because you just prep the dry ingredients and you don't have to do anything special for them.
Yeah.
It's just,
Salt. It's just salt. Yeah,
Red
take
meat,
salt in.
Yeah.
And the electrolytes. Take vitamins every day. Vitamin D. We're horrible. Humans are horrible about, and we're always lacking vitamin D. Unless you live in a desert climate, you're not getting your vitamin D. Take simple little things.
yep.
Red mint salt, not sodium.
What's wrong?
Red mint salt.
Oh yeah,
not
Angela's
sodium.
over here talking about the salt for the electrolytes. Make sure you don't want the iodized stuff. You want natural salt.
No.
Those are much better.
What is it?
Redmond.
Redmond's, I think.
Yeah, Redmond salt.
Yeah.
Yep.
Yeah, not sodium. You want salt, not sodium. Yeah, I mean that's the thing.
Yep. Guys, do you guys have any questions for Chuck?
Charlotte had one.
We got him here right now, and let's pick his brains. What did Starla have?
She wants to know how much the class is.
Oh,
You might want to verify if that's going to happen.
oh, here we go. Starla has a question here. I'm wondering how much the class is. Let's talk about the classes you do at the festivals, and then talk about the ones you do personally.
So my personal classes, I have a minimum amount of money I need for me to show up. You have to make it worth my while. I'm traveling to you. It's one flat fee. I don't put in hidden fees for anything. I tell you, and it's usually based on the number of people that are going to be in your class. It could be anywhere from $200 a person to $800 a person. Depends on what class it is and how long it is. And we could talk about that and negotiate some things like that. I'm flexible on that stuff for my personal stuff. The classes that are coming up, I know this sounds bad, but I'm not sure how much they are. I believe the one at SRF is 145 or 150. Tickets are on the selfreliance.com website. You can go to that, and it's the Advanced Wound Care course. For Kentucky Sustainable Living, I don't know if Jason's still in here. I think it's
there's the link for Self-Reliance Festival.
Yeah, I think it's $200 for the one day, I believe. Now, with my courses at Kentucky Sustainable Living and at Self-Reliance, you're also going to get a kit to take home with you. At the Advanced Wound Care course in Self-Reliance, you're going to get a long-term wound care kit that you take with you. It's not what you're going to use in class. This is a kit you're going to take home so you're ready to do some of the stuff. Mm-hmm. At Kentucky Sustainable Living, I can't announce what it's going to be because I'm debuting it at Kentucky Sustainable Living, what this product is. But every person who's attending the Homestead Medicine course is going to get one of these. And it's a substantial kit that you're going to get and a piece of equipment you're going to get. If you take the emergency trauma class at Kentucky Sustainable Living, Stop the Bleed Emergency Trauma, which is a half-day course, you're going home with a tourniquet, a CAT Gen 7 tourniquet.
Excellent. It's always good to be able to take something home with you.
Yeah, so you walk out of that course, I'm going to teach you how to use a tourniquet and stop emergency bleeding, how to use a pressure dressing, how to pack a wound, how to use a chest seal. But when you leave the course, you're going to have that tourniquet in hand. And it's a real one. It's not a training one. It's going to be a brand new tourniquet in the package, but I won't let you leave with it still in the package. You're going to have that tourniquet staged and ready because I do this all the time. I'll see cops out, and I just walk up to them because you can see it in their chest carriers. Mm-hmm. You know, they're over the uniform. I can see their tourniquet in their pouch, and it's still in the package. And I'll walk up to them, and I'm not, I do it kind of privately. I said, hey, would you step over here? Let me talk to you. And I'll go, take that tourniquet out of your pouch and take it out of the plastic and get it ready and stage it. If you don't know how to do it, let me show you. Because, and if you ever see somebody like that and you see somebody, show them how to stage a tourniquet so it's ready. Your tourniquet should, and people may not understand what I'm talking about. I've got a little rubber band over this tourniquet that I keep in my pocket. And what I mean by staged is it's the way you fold it. When I take the rubber band off, which I can pull and break if I need it quickly, my tourniquet's ready to go. So I can go and self-apply, or I can go and put it on somebody immediately. That's the thing. Prep your equipment. Have it ready, because when you need it, where's your adrenaline going to be?
Right.
So
first thing they teach us in tactical classes is if you are not practicing it constantly, you're going to forget about it, and you're going to go to what you have been, the habits that you've developed over time.
Right. And I see people here in the chat, talk about some supplies and stuff like that. I'll ask any questions. If you all want to get a hold of me, I don't mind to talk to people who are in the group, and do a little consultation. It ain't going to cost you anything, but I will build you whatever kit you need. And like I said, again, my classes that I come and teach to you, that doesn't have to be a canned class. I will custom design and custom build a class and curriculum around your group of what you're wanting to learn.
And I'll tell you what, I'll tell everybody in chat, the easiest way over the next 2 or 3 months to talk to Chuck and get one-on-one with him is to go to one of those festivals. Better yet, go to all 3 of them, because little behind the scenes, inside baseball here, the people promoting the Midwest Preparedness Festival, Self-Reliance Festival, and Kentucky Sustainable Living are all trying to work together and coordinate what we're doing so that each festival builds on the next one. In fact, Spags and I were talking the other day, and he was talking about the North American Preparedness Tour, which is Self-Reliance, Midwest Preparedness, and then Kentucky Sustainable. So that's the best way. If you want to talk to Chuck one-on-one, I've seen Chuck. He stops and he talks to people all the time at these festivals. So that's the best way.
That's why I go to the festivals. I'm not there. Do I want to sell gear and make money? Of course I do. Do I want to sell kits? And I'm there to talk and present. But the biggest reason I go to these is to talk to everybody. Is to be able to see Grumpy and Yoda face to face, to see Spags, to see Jason, Jason and I are very good friends. We met at Self-Reliance Festival, and because of that have become very close friends. We talk 4 or 5 times a week, all these people, and you look up these, go to these festivals so you can see these people, talk to them face to face, and I guarantee you'll meet somebody that you'll end up staying in contact with on a weekly basis or maybe even a daily basis. My whole life has changed because of this, from going to the first Self-Reliance Festival. And now I'm presenting at all 3 of these, from going as attending these, to a conference, to now where I'm teaching and I have a business. And all of it is from this network. Yep.
We got our start. I mean, the reason why I'm sitting here talking with you is because Darren and I went to that very first Self-Reliance Festival we went to, and John Willis is actually the one that got us started down the road to selling freeze-dried food.
That's why I have a business, is John Willis, because I presented a couple of times at Self-Reliance. I taught for other people, but I didn't have my own business then. And I had a lot of people coming to, hey, can you come teach a course? Can you do this? Can you do that? Will you come to me? Rosie's going to be at all 3, and it's going to make my sugar go up and make me fat.
Yep.
She makes great food, great candy, if you all didn't know that. But anyway, John is the whole reason. And I finally, at one Self-Reliance, I said, we were talking after, one evening, a few of us were hanging out, and I said, I think I'm going to start a business. I'm thinking about doing this and doing the teaching thing and doing my own thing. And he goes, no, you won't. He goes, you're just talking stuff. You won't do it. Well, that made me mad enough that I went and did it, and that's what motivated me, which John is a master at. And I ask John all the time, him and Amanda both, business questions. They're kind of mentors to me, and really this whole network. I look up and I consider a mentor of you and Tag and Spags and even Jason, and just all these people you learn so much from. And it's not just preparing or homesteading. It's life choices, life lessons,
Right.
you know, that you can apply every day. It's actionable knowledge and information that you can apply and make your life better. And I learned something from everybody. And that's why I love going to these events, because I'm telling you, it changed my life completely.
Yep.
And I meet more and more people each time. And it's just, you know, I'm excited every time to be part of this community. Like Jeremy Kirby, who's in the chat now. We're all in a little group. We've got a chat group. It's about 5 of us that we literally talk every day. Every single day, we're passing along information and talk that we all met from this community. And I consider them friends. You know, these are people that, hey, I need something. Like Jeremy's a truck driver. If he's anywhere within a 4 or 5 hour radius of me and he breaks down, I'm on my way. I mean, if I'm the only one and it's a 12-hour radius, I'm on my way. I'm going to help these people. If you all called me up and said, hey, we need your help, we need you here now, I'm packing a bag and going. Because I consider that you people close to me, and I value the information and value the things you all do to give back to the community. Right. You know, like this, well, you know, your channel.
And we try to pay it forward. You know, Rosie's in the chat, and we met her at that very first one Darren and I went to. She was selling her goods, but she wasn't really sure how to do it and stuff. And then her and Yoda started talking, and we encouraged her. And now look at her. She's going to these things. She's going as a vendor to Midwest. In fact, she drove up last spring, and just showed up and was like, okay, I'm here to set up a table.
She asked me before that. She'd sent me a message, because Rosie and I'll exchange messages, and I'm also one of her test dummies. She'll mail me some of her new stuff every once in a while, and I get to taste it. So I love Rosie. I met her when she actually worked for John at Special Operations, and she's some of the best people you'll ever meet.
Yep.
And she asked me, she goes, should I go to Midwest? I said, yes, go sell your stuff, you know. And that's what I told the first time she was doing that at Self-Reliance. I was like, you need to scale this up. This is great stuff. And, you know, it's all these people that are in this network. We all need to, you know, get together and support each other and push whatever goods or whatever services we provide out.
Starla's going to be up here. She's going to bring a trailer, right, Starla, so you can buy this stupid Amish buggy off me.
And Starla,
go on.
Starla talked to me. She'd asked a question about, I think she said MS treatments, if there was any alternate treatments. But talk to me at Midwest, and we'll go over a couple things that you can kind of prepare with that. Because I've got a cousin who has MS and stuff, so it's kind of close to me also. I've done a little bit more research on that, on alternate things to do. But get with me, Starla, or send me an email. You can email me anytime. We can talk. I'll call you, and we can talk about some things.
So Jeremy, Rosie sells the most indulgently wicked candies and treats. She does these keto treats that do not seem like they're keto, and she does these alcohol infused treats that are just off the chart good. And yeah, she is really, really good at it. And every time we see her product gets better and better and better.
Oh yeah. She's got a couple of things that she knows I love, and she always makes them for me. It's great, because as soon as I show up at like Self-Reliance and she's there, I've got food being shoved in my mouth by Rosie for me to try stuff, and which believe me, I love. That's one of my, now that I look forward to, that's one of my most favorite parts of going to Self-Reliance, is to be able to see Rosie, you know, and now she's going to be at all three, which is even better.
So Rabbit wants to know about our Amish buggy. It is a closed top buggy. In fact, we found a sales receipt for it whenever we were cleaning it from 1982, and it was from Jamesport. It was sold up in Jamesport, Missouri. And Tag, too bad Tag's not in here because I'd give him grief. Tag goaded Yoda into buying it at an auction when I wasn't there. So she came home with this stupid buggy, and I was extremely upset about it. You know, and I still owe Tag for that, and I'm not quite sure how I'm going to get even with him.
That could possibly be you could turn that into a little backup ambulance. You know, you may need that in your community to transport people around when they're sick to get them to a clinic. You know, it could have uses.
Dude, I don't want to deal with horses. That's the whole thing about it. It's actually a pretty cool buggy. It's still, even though it sat here for a year, it's still in really good shape. But yeah, I don't want to deal with horses because they're like black holes out in the middle of a pasture, just sucking up money. You know?
Yeah, yeah. I know. I've got so many half-started projects and stuff,
Yep.
and it just gets overwhelming after a while. And then when you get busy, and I'm fortunate, I'm busy even away from my real job, as I call it. But really,
Mhm.
I hope to make this business. You know, I want to scale it up to where it is my only job. It's my full-time job, and I just want to bring this stuff to everybody. I think it's important, and I like doing it. And I try to make it economical enough to where it's affordable. But if you look at some classes, like, and I'm not going to mention anybody, I respect these people, but I saw one class for a half-day course, and it was just an emergency trauma course. It was $400.
Mhm.
That's how much one of my 2-day courses cost. And
Right.
I think good for them. They're able to get that money, but I just can't. Is my information valuable? Yeah, I do. Should I charge more? Yeah. But I want to get this information out. So I try to make it economical enough that people can afford it and get this, what I feel like is truly valuable training.
Yeah. There was a class at a Central Missouri University there in Warrensburg that was a 2-day class, and it was $1,200, and it was combat first responder, and you could bring your entire technical kit except for no weapons, and $1,200 for a 2-day class. You know, and it's just
Yeah. Yeah.
and like I said, I'm all for if you can afford to spend that kind of money, because I'm sure it was a pretty high speed class. I mean, it's I know knowing the program that it came out of, I'm sure it was a high speed class. You know, and if you can afford that, do it. But most of us, I know I can't afford $1,200 for a class.
Yeah, some people can. And I've taught classes like, you know, the live tissue, and it was a live fire, live tissue class. You know, we did a combination. It was a tactical live fire, live tissue, and it was a 4-day class. And, you know, it was costly, but I promise you, you won't find another class like it anywhere.
Okay, so Starla missed the answer about the gauze, and basically
Oh,
Starla,
okay.
it was you need to sterilize it. You need to sterilize it, or else you're going to cause infections. All right?
Yeah,
Am I? Did
Starla.
I?
Yeah,
Go ahead.
yeah. I mean, that could be a backup, but I would just buy gauze. Gauze, it comes. It's in a protected package. The problem is, even though you may cut those into strips and put them in a sealed plastic bag, there still could be bacteria on there. And it's not sterile where the individual packaged gauze. Now, when you buy bulk gauze, make sure they're individually packaged. Okay. In other words, like your rolls of gauze, you'll get some that are bulk, and you'll get 20 rolls of gauze in one box. Make sure each roll of gauze is individually packaged. Try to get 4x4s and 2x2s that are individually packaged. You know, like 4x4s, you buy a box, there's 20, they'll say there's 50, you'll get 25 packages, but there's 2 4x4s in each individual package. So I would just highly, gauze is cheap, folks, just buy it. That's going to be your safest thing.
So, are you giving a class at the Midwest Preparedness Festival, or are you just there as a participant, if I may ask? Yeah, I don't know. Is
I'm
it a
doing
secret?
I'm doing a presentation.
Okay.
I could talk to people, but I'm not doing an actual hands-on class. I'm doing a presentation on some stuff. But you know, while I'm there, I'll show people stuff. If somebody comes up to my vendor table, I'll show you how to put a tourniquet on. I'll show you how to pack a wound. I'm going to have some of my training simulators and stuff there to let people practice on, and we'll put you through the stuff and let you see what it is. But you know, unfortunately, there's just the time constraints with the festival and stuff. There's no way to do, as of yet, to do a full-blown class. But hopefully in the future we can work something out, and I'll be more than happy to do it.
Okay. So, you guys, does anybody in chat have any more questions? We're going on an hour and 40 minutes, which is I like to keep these things right around an hour and a half, just because
Yeah.
people lose interest after a while. Unfortunately, no matter how interesting it is. So if anybody has any questions in chat, go ahead and get them in there now, and we'll get an answer from Chuck. If anybody, yeah, okay. So Rabbit Coyote mentioned Uline and then Medline. I guess Medline's another distributor for medical stuff.
Uline can. I mean, there's different distributors. If you want to contact me, I'll let you know some stuff. But like I said, I can arrange to be able to get you some bulk purchases or do some stuff and put kits together. But if you need some information on best places to buy, trusted places to buy, I'll be more than happy to pass those along to you.
Yep. Okay. Well, it doesn't look like anybody has any more questions. Chuck, you got any final thoughts you want to share with people? Tell people where your website is too. Make sure you give that a plug while you're there.
Yeah, it's at homesteadmedical.us. My email is chuck@homesteadmedical.us. My class descriptions are on there. Email me. We'll set up a time. I'll call you, and we can come up with something, whatever you need. My web store is down right now. I'm actually converting over to a different web store, so I'm rebuilding all that. So if you need equipment or kits or anything like that, email me, and I'll make arrangements so where you can order them, and we'll put together something for you. Anytime anybody puts an order in, I usually throw in something else, a little extra for it. And I've kind of followed the John Willis method of everything. I stick business cards of other businesses who are in the network to promote. And another thing, final thought is, one of the other preps you need that go hand in hand with medical is.
YouTube does not want us to know what goes hand in hand with the medical training. So let's stick around. Hey, we don't need to ask that question, Yoda, because we know what the answer is going to be. It's just going to hurt your feelings. Okay.
Okay. That's a loaded question. I love you both equally, but Yoda may have a slight edge.
Okay. Chuck, you locked up right when you were getting ready to tell us what was the next thing right behind medical to prepare for.
Communications. Get radios. Go to radiomadeeasy.com. Evan, he's part of the network. Get your communication squared away, because what's going to happen is you're going to be in a situation where, all right, I'm stuck. I don't know what to do. But you can reach out via radio, telemedicine, and maybe get a hold of a paramedic, a doctor, a nurse, or something like that, who can walk you through something or do something, and they're going to ask you questions, and you could have a telemedicine consult like that to where you could help somebody. So I think communications is probably one of the most important things you need to have with your medical preps, anything. And obviously communications is going to cover so many other different things, but that's what's going to happen in the future of, you see it now, you're doing telemedicine, via Zoom calls and things like that. What do you think is going to happen when you have a society?
Nope. Starla, you said you keep. It's Chuck's internet is where the problem is. Uh-oh. We got critters starting to come out.
But yeah, get your radios from Evan at radiomadeeasy.com.
Yep. Hey, hush. I'm not sure what I think there's a critter out there in the field someplace. But yeah, this is what we deal with here.
Yeah. Yoda wants to know who my favorite is. I love you equally both, but Yoda, you might have an edge just because you make that food. The freeze dried stuff is the stuff I love.
I got no problem with that. I got no problem with that at all. Yeah. Okay, let's see here. Before we close out, apparently the dog's barking scared the crap out of Freedom's still back.
Rosie, I'll be at SRF on Wednesday. I'll actually get into town Wednesday evening.
Yep. And we will be, I think we're getting there Friday. I think we're leaving here Friday morning, so we'll get there Friday evening. But so yep. As far as us, we are going to be at Marshfield in a week, actually 2 weeks from today. Marshfield, Missouri for the Ozark Homestead Expo. And then we are at Back to the Land and SRF in Tennessee, back to back. Then we're at Midwest Preparedness Festival. And then at the end of October, we are at Kentucky Sustainable Living. And then I am done with doing anything for quite a few months because it's extremely tiring. And every time we do these long weekends, I'm away from the homestead and I just got so much stuff I got to do.
Yeah,
you know,
I love going to them, but the travel and being gone when you get back, you've got, especially all these are in October. So trying to fit everything to get in between traveling is it's going to be fun.
Yep. You guys can go see our stuff at grumpyacresfarm.com. It's a work in progress. If there's something that you don't see there and you want to ask about it, go ahead and email us. Yoda's really good about getting back to people about that. And she does custom orders. In fact, she's doing a custom order for Trip from Solar Oven or Sun Oven. He is going to take our freeze dried goods and cook them in his big Villager Sun Oven there at Prepper Camp in September. And when is it? September 23rd, 24th, 25th is when that is.
Not sure those are the exact
No, they are. I looked them up today. But yeah, so he's going to be doing that. So she can do custom orders. Other than that, we appreciate everybody showing up.
Yeah.
Chuck, you want to close out with anything?
No, I'll be at all the same ones you will be, except for the one you're going to this week. But I'll be at all three, the Three Sisters as they're calling it, and I look forward to seeing everybody. And if you need anything, please reach out. Be more than happy to help anybody in the community and our little network that we have here. And hopefully we can train together soon.
Yep, absolutely. And like we say, Chuck, stick around. Don't run off.
Sure.
Like we say every time we close out a video or a live stream, go out and be free. Or we don't say that. We go out and live a life done free.
Be 1% better.
Be 1% better tomorrow than you were today. Okay, guys? Take care. And let me click this button.